Back in Guyana, I also had a 4-year degree from the University of Guyana in accounting. And actually, I wanted to do medicine. But at that time, my country was going socialist, and they were sending students to Cuba to study. And once you got there, sometimes you never got a chance to return home within 2 years, whenever the government could afford. And I was married and had my kids, to be left with my husband. So I couldn't make that sacrifice. So I took a scholarship from the government and I did accounting. I served them, and then when I decided to come here, I wanted to still pursue my dreams of doing something in the medical or in the science field, because I was qualified scientifically as well. I was always curious. I became concerned rather about the treatment I would have gotten from the nurses, because, as kids we were afraid of, as soon as it was injection, the needle, and it's going to stick you. And they were so kind and compassionate towards us as little kids, to make us feel at ease and lessen the pain. So I said to myself, I really wanted to be that kind of person to others. And then I realized that I really wanted to be in the healthcare field, where I would have to interact and treat people just the way I wanted to be treated. I was very elated to have been chosen for that scholarship, because in America, in Brooklyn rather, there are lots of people who are eligible, and I was one chosen. I did use it to buy books, which are very expensive. It was my 4th semester nursing, and it required a lot of reading materials. Not only the required, but there were books that were optional that assisted you in, understanding the subject matter. And I really used that money for that purpose. Yes. I think that I was chosen based on my zeal to pursue and have nursing education. I felt that the thing that I would contribute, that I was matured enough, I knew what I wanted, and I knew how I'm supposed to treat people and the services that I'm expected to render to people, and also based on my academic achievement. It was a challenging program, very difficult. You had to study, you had to put in a lot of work, make a big sacrifice, but we got the support that we needed. That was important. The care and concern when we weren't doing, when there's some students are not going to be doing well, and no matter how exposed you are, there are some things that are really going to challenge you. You will not be an expert in every area. So I would take that camaraderie, the cooperation, that love, that compassion, I would take that with me wherever I go. And I like to be the same person to others, not only patients, but my workmates. I would love to take that over with me.